Naturalhealthcare.ca, Canada's guide to complementary and alternative healthcare.
Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today we're going to be talking about treating injuries. Everything from sprained ankles to tennis elbow. And to help us with that today, we have a special guest with us, Dr. Tracy Schlachta, who's a chiropractor.
Woohoo! Normally at this point in the show, I will take a vitamin, hence the whole Vitamin Junkies theme. However, today I thought we'd do something different. When I did the Ride to Conquer Cancer, where I biked from Toronto to Niagara Falls, woohoo, 215 kilometers, raised $14 million for cancer.
Not you personally, overall. Everybody did.
We all did.
Yes.
All of us, over 1,000 riders, raised $14 million for cancer. And I don't usually have knee problems, but after the bike ride, my knees were really sore. And I went to see an osteopath for treatment, and they fixed it after. So I thought it'd be a nice little segue to talk about that, and have Dr. Tracy here, who's going to give us the lowdown on how to treat injuries after exercise.
Okay. I think the first thing we'll talk about today is the whole ice versus heat debate. I get that question a lot from my patients. Well, what do? I use heat sometimes. Some people tell me to use ice. It is a little bit controversial, and it probably depends a little bit on the individual.
I'm pro-ice.
Pro-ice? Okay.
Yes.
The general rule of thumb is to ice immediately after an injury. So when an injury is what we call acute for the first few days, you do want to put ice on it for about 15 minutes at a time to take down the inflammation. After the first few days, some people find it beneficial to start alternating between the ice and the heat, and they find they get more optimal results doing that. If, however, you're someone who has a lot of muscle tension from work or you've pulled a muscle, you may find that a moist heat actually works the best. And the way to do that is to get one of those gel packs or something that you can heat up, and then perhaps moist a tea towel in warm water, wring it out, and then wrap your warm pack in it, and then place that on the shoulders or whatever part of you might be sore, and you'll find that that probably relaxes a muscle and loosens it up a little bit for you.
We typically use frozen corn.
And frozen peas or corn works really well.
Yes.
Yeah, if you don't have a gel pack, absolutely.
That's
Yeah.
a great idea. Yeah.
Whenever my boys have an injury, oh, do you want some ice? You put the frozen corn
Frozen
on it,
peas or corn.
tears go away.
That's great.
Yeah, and always in the freezer too. It's one of those staples.
Exactly, exactly. I have my designated frozen corn pack.
I'm not going to eat the corn at your place.
No.
No, don't eat the corn at your place. It's tainted.
Okay, did you want to talk about active release or?
Sure,
tell us
Yeah,
about
that'd
that
be
with the ice and
Yeah,
heat?
tell us more about that.
So
Yeah.
active release is a therapy that a lot of people are starting to hear about. It's been around for quite a while. It was developed to break up scar tissue, and originally it was probably mostly professional athletes or high-level athletes that had this type of therapy. But we now use it for everybody. It doesn't matter if it's tennis elbow from playing tennis or if it's tennis elbow from being on a mouse all day. What it does, active release therapy breaks up scar tissue and realigns the fibers. The problem with scar tissue is after you've injured yourself, the body tries to heal itself by laying a mesh of tissue in a crisscross pattern, and that's the scar tissue. And scar tissue is very weak. It's actually not that strong, so it's not a great form of tissue. So what we want to do is break up that tissue and then with some gentle strengthening exercises realign the fibers so that it's stronger. So active release therapy is something really beneficial from, you can use it from ankle sprains to, as I mentioned, tennis elbow, really great for runners, something called IT band injuries. You do need to go see a certified practitioner for that, but it's well worth it. It really works well.
And what type of practitioners are typically certified?
Generally, chiropractors like myself may be certified. Some physiotherapists are certified. Massage therapists can be certified. Sports injury specialists, that type of practitioner, if they've gone out and done the extra training.
So is it an ART?
It's actually, yes, it is an ART designation, correct. And you'll see that after the name.
So that stands for active release
Therapy.
therapy.
Yeah, or technique. Some people, I've seen it technique as well.
Okay.
It works like a charm. It hurts a lot for a fraction of a second.
It can be uncomfortable. Hopefully the
That's
practitioner
what I'm
works
used
with
to.
the patient, and
Mild discomfort.
but it is well worth it. It really, and the nice thing about active release is it does work relatively quickly. Some people find results after the first treatment. They find they've loosened up. Generally speaking, 6 to 9, 10 treatments, and people are well on their way.
Very good. Now, a common thing that I've heard about is just doing Epsom salt baths. How is there particular injuries that works better for, or not? Or
For myself, what I recommend is if anybody's going out and they're going to be painting all day, or they're going out for an extra hard run, or they're working out extra hard, an Epsom salt bath is always a great idea to do after the fact, because what it does is it actually takes away what's called the lactic acid, and lactic acid is what makes you sore and tired the next day, and if you can draw that out of your body, then you'll heal a lot quicker and you won't have that soreness and the stiffness the next day. So typically we tell people to take about a cup of Epsom salts and put it in a bath and soak the body part for a good 20 minutes, half an hour. I then would recommend showering off if possible, just to get the salt off you, and hydrate, because it is a salt, so you want to make sure you replenish yourself with water.
so is it the effect of the salts, or is it the heat? Like, what about the far infrared sauna? Is that the same sort of effects? That
Yeah, well, no, it's a different. It's a bit different for something like infrared sauna. The idea with the infrared sauna is that it penetrates about an inch into the skin, so it'd be improving the microcirculation. So it'd be repairing the area where there's scar tissue and there's some inflammation after exercise. So that'd be more the mechanism, whereas the Epsom salt pulls out the lactic acid. So it ends up being roughly the same result, but just a different way of doing it. But Epsom salt is definitely cheaper, and there's not, a lot of people don't have access to infrared saunas.
Yeah.
So Epsom salt will cost you maybe $2 to buy a little salt, and you toss it in your tub.
Yeah, and the key is to do it, the day of the action, or the key is to do it the same day as the injury.
the
The
injury.
injury.
The injury or
Yeah.
the activity. You want to don't want to do it 24 hours later. You want to do it the same day.
You gotta do it right away.
That's what
and
I'm trying to
just
say.
Very good.
relax in the tub and
Yeah.
celebrate your victory.
Now, what about some other modalities? There's the cold laser therapy.
Yeah, that's a relatively new one as well. We do have that in our clinic, and we've had phenomenal results with it. For someone who's acute or just injured themselves, typically it doesn't take very long, sometimes only 6 or 7 treatments and they're well on their way again. Somebody who's coming in with a more chronic injury that's been around for a year or more, it does take a lot longer. Each session is relatively quick. It's about 2 or 3 minutes per spot, but you will need to come in probably for a number of weeks at a time, possibly 4 to 5 days a week. So it's a little bit of a time commitment, but it really does stimulate healing, and we've seen some phenomenal results with it.
And is that something that you do in conjunction with the chiropractic care?
Yes,
Or
yes, because the chiropractic care, we can do joint mobility, we can be doing the active release, and then adding the cold laser therapy. Just the trio often is the ticket. You might only get 50% better with each of them, but if you put them all together, you get 100%. So
awesome.
works well.
Acupuncture, ultrasound, supplement side, proteolytic enzymes, bromelain, turmeric, so natural anti-inflammatories, which are very good for decreasing the inflammation in the area. Fish oil, arnica, topically or homeopathically. Also, a lot of the joint support things such as glucosamine sulfate, MSM. There's a lot of things you could take, definitely to help.
So is this something that I can just walk into a health food store and just grab something, or should we see a naturopath or a chiropractor and find something that's really suited for that particular injury?
Yeah, when you're injured, if you want it to take longer and possibly permanently damage the area, it's possible. In a lot of cases, if you fix the injury right away, you could get back to how you were before and return to the exercise or the activity that caused it. I would say a healthcare professional.
I agree.
I wouldn't roll the dice. I would just, if it's important to you, I'd go see someone like us.
And get it accurately diagnosed as well.
Definitely, yeah. Get an X-ray if it's required. A lot of people have walked on fractures and they haven't realized it. Like,
Stress fractures. Yeah.
So,
Very good. Well, thank you. And if you did want to find a practitioner, a chiropractor or a naturopathic doctor or a massage therapist or physiotherapist, you can go to our website, www.vitaminjunkies.com, and you can click on the Find a Practitioner link. And while you're there, don't forget to join the addiction and subscribe to the Vitamin Junkies podcast. You'll receive a notification every week when a new podcast is released. Thank you so much for joining us this week, Tracy.
thank you. That's great.
I'm Jennifer Lyle.
I'm Dr. JJ.
And I'm Dr. Schlagda.
Continue the addiction to good health.
Bye.
Do, 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 do.